Welcome to The Explainer. Today, we're cracking a medical case that baffled physicians for years, a condition caused by a tiny, hidden culprit that has absolutely massive consequences.
Just imagine for a second, what if your stomach's acid switch got stuck in the on position? I mean, producing acid completely uncontrollably, day and night. It would lead to this relentless, painful cascade of symptoms. Sounds like a total nightmare, right? Well, for some people, it's a reality.
See, this isn't some hypothetical scenario. It's a real condition, first described way back in 1955. It's called Zollinger-Ellison Syndrome. You'll often see it called ZES, and for the longest time, it was a deeply frustrating medical puzzle. Doctors were seeing these patients who were suffering from this whole collection of symptoms. They had these severe, reoccurring ulcers, but get this, often in really strange places where ulcers just shouldn't be. They had terrible acid reflux, chronic diarrhea, and here was the kicker. None of the standard treatments were working. That pointed to some other powerful, hidden cause. So, the investigation shifted. It moved away from just the symptoms and toward finding the source. And it pretty quickly became clear that the problem wasn't really with the stomach itself. No, this was a rogue agent, flooding the body with a powerful hormone, effectively hijacking the entire system. And the culprit? A gastrinoma. Now, this isn't just any tumor. You can think of it like a tiny rogue factory. It's just pumping out this hormone called gastrin, but its gas pedal is permanently stuck to the floor. It's constantly just screaming at the stomach to make more and more acid. And investigators even found its typical hideout. Most of these tumors are found in what's known as the gastrinoma triangle, which is this anatomical area right in the center of our digestive system. But even when you know where to look, finding them is incredibly difficult. And that's because they are unbelievably rare. I mean, we're talking about maybe 1 or 2 cases per million people each year. And this extreme rarity is exactly why the diagnosis can be so tricky, why it's so often mistaken for more common GI issues for years on end. So, how does a tumor that's often just tiny cause such widespread, severe problems? Well, it all comes down to this powerful and really damaging chain reaction that it sets off inside the body. So here's how it all goes down. The tumor just starts producing these massive amounts of gastrin. That gastrin then overstimulates specific cells in the stomach, and they respond by pumping out extreme levels of acid. This acid is so overwhelming that it physically damages the gut lining, and it even neutralizes the enzymes we need to digest our food. And that leads directly to those severe ulcers and the chronic diarrhea. So to solve this mystery once and for all, clinicians pretty much have to become detectives. They follow a very clear 2-step process. First, you confirm the crime is actually happening, and second, you find the hidden source. It's a really clever strategy. Step 1 is all about the lab work. You use blood tests to get that biochemical proof of overproduction. Then, and only then, in step 2, do you begin the physical hunt for the tumor itself, using advanced imaging. And this is the biochemical smoking gun. It's a simple blood test that measures the level of gastrin. If that level is more than 10 times the normal limit, we're talking over 1,000 picograms per milliliter, that's it. It's diagnostic. There is no other explanation. That rogue factory is hard at work. So once the gastrinoma is confirmed, the hunt begins with a really high-tech imaging toolkit. The gold standard is a special PET-CT scan that uses a tracer that literally makes the gastrinoma cells light up. Of course, CT, MRI, and especially endoscopic ultrasound are also used to pinpoint the tumor's exact location and see if it is spread anywhere else. All right, so the culprit has been found. What happens next? A multi-pronged attack is launched, not just to relieve the symptoms, but to neutralize the threat right at its source. The treatment has 2 parallel goals that get tackled at the same time. First, shutting down that acid production for immediate relief, and second, managing the tumor itself, the underlying cause of the entire problem. And the treatment is never one size fits all. It's a tailored combination of different therapies. For localized tumors, surgery is the main goal, of course, but medical therapies are also absolutely key. High-dose acid suppressors, called PPIs, are the cornerstone, while other drugs can slow the tumor's hormone production and even its growth. For more advanced cases where the tumor has spread, the arsenal gets even more sophisticated. You have targeted therapies that can block the specific pathways fueling the tumor's growth, and that can effectively double the time before the disease progresses. And then there's another technique, PRRT, which acts like a smart bomb, delivering targeted radiation directly to the cancer cells. And this brings us to a really critical and kind of sobering fact. Because the early symptoms are so easily mistaken for other conditions, about 60% of these tumors have already spread by the time they are finally diagnosed. This is why early suspicion and diagnosis is just everything. This chart shows you exactly why that matters so much. If the disease is caught while it's still localized, the 5-year survival rate is excellent, over 90%. But if it has metastasized, that rate drops significantly, all the way down to between 20 and 50%. The difference is it's stark. You know, the story of gastrinoma is more than just a fascinating medical mystery. It brilliantly illustrates this fundamental principle of medicine. You have to look beyond the obvious symptoms to find and treat the root cause. And it really leaves you wondering, what other complex conditions are just waiting for us to find their own hidden switch?